California Fertility Partners, we treat all individuals regardless of their sexual orientation. I treat lesbian women, gay men, and transgender individuals who desire to have a child. For lesbian women, there's several treatment options. We usually start with something simple like a natural cycle insemination. In this procedure, a woman monitors for ovulation, and at the appropriate time in the cycle, we would thaw the donor specimen and place the sperm in the uterus as close to the time of ovulation as possible. Another treatment option for lesbian women is to do in vitro fertilization, and some of our patients prefer to go directly to IVF due to the higher pregnancy rates per cycle. In an IVF cycle, we stimulate the ovaries to make multiple eggs, retrieve the eggs surgically, fertilize them, culture the embryos for 3 to 5 days, and then select the best embryos for transfer into the uterus. Now with IVF, there's additional option. For a lesbian couple, we can do IVF with transfer the embryos into the woman producing the eggs, or we can do reciprocal IVF, where we can retrieve the eggs from one woman of the couple and transfer the embryos into her partner. There's two options for donor sperm. A woman can select an anonymous donor through an established sperm bank, or she can use a known donor, maybe a friend or family member that has offered to donate sperm. In either case, the sperm donor is extensively screened according to FDA guidelines to make sure the sample is safe to use in the treatment cycle. It's also essential that lesbian women consult with an experienced reproductive attorney before beginning the process so that it's very clear who the legal parents will be. And the laws regarding this matter vary dramatically from state to state, so it's important to consult an attorney who works in the state in which you live. For gay men who wish to start a family, the most common techniques used is a combination of donor egg plus gestational surrogacy. So when I initially meet with couples or individuals who want to start a family, we start by ordering a basic semen analysis. And this semen analysis is going to give us an idea of the count and quality of the sperm, just to make sure we have sufficient good sperm to work with in the treatment process. So I refer my patients to the surrogacy agency, and they'll match them with a surrogate mother. And the agency will then refer the surrogate mother back to me to complete her medical screening. And I carefully screen these individuals to make sure that they will provide the best environment for the pregnancy, for the developing baby. So they undergo a complete, thorough physical exam, uterine evaluation, infectious disease testing. They've already been screened psychologically by the agency, so I know this is a woman who's very committed to being a gestational carrier and who's really devoting a year of her life to help another individual have a child. So these are amazing women who are very involved, very committed to this process. So once we've been matched with the surrogate mother, the next step is to select an egg donor. And the egg donor is a critical part of the process. This is the young woman who's going to contribute genetic material to the child. The egg donors are between the ages of 20 and 28 with a completely normal past medical history, and they also undergo a complete medical evaluation to make sure that they're going to be a good candidate for the treatment process. And most of my patients select someone that either looks like them or a family member. And you receive a lot of information on the egg donor. You see pictures, profiles. You have the option of meeting the donor or being completely anonymous. So now we've completed medical screening on the egg donor, the surrogate mother. Everyone goes back to the lawyers to complete the contracts. Once we have all the contracts signed, we're ready to begin medical treatment. And the medical treatment simply is the egg donor undergoes an IVF cycle. So we're stimulating her ovaries to make multiple eggs. And at the same time, the surrogate mother is on hormones, estrogen followed by progesterone, to make sure her uterus is in synchrony with that of the egg provider. The eggs are retrieved and inseminated with sperm. Now we may have 1 or 2 sperm providers. If we have 2 sperm providers, we simply divide the eggs into 2 groups, and sperm provider 1 gets half, sperm provider 2 gets the other half. We'll culture the embryos for 5 days, and on the 5th day of culture, we would select the best 1 or 2 embryos at that stage, they're called blastocysts, and transfer them into the surrogate's uterus. And the intended parents can be here for that procedure so they can see their embryos under the microscope on the day of transfer. They can be here to support their surrogate through the process. And so it's usually a very emotional day in our office. For a transgender individual, it's essential to freeze your reproductive tissue prior to your reassignment surgery. And that tissue, whether it's frozen sperm or frozen eggs, can be used to help build your family at a later point in time, because once you have your reassignment surgery, it will be too late. For the past 15 years, I've been helping gay men have children through egg donation and surrogacy, patients from around the world. And these little babies born become little ambassadors that help teach others that gay men can have children and can have families just like everyone else. And oftentimes, the surrogate mothers live in these small towns in middle America, many times in conservative parts of this country, and their neighbors, their church members are all learning that they're carrying a child for a gay couple. And slowly but surely, we're helping to change the attitudes and the opinions of people across America that it's okay for all individuals, regardless of their sexual orientation, to have babies and create families. It's really quite beautiful. At California Fertility Partners, we've always welcomed gay men and women who wish to start a family, and then there's many treatment options available. Our doctors, our staff members all look forward to helping you on your journey to becoming a parent.